Hello, I am Dr. Mini Nair, founder and chief physician of Healing Ayurveda and Siddha Hospital, 6th block, 18th Main, Koramangala. Hemorrhoids, or what we call commonly known as the piles, is nothing but the dilated veins in the rectum or at the anal canal. Based on different stages or based on its presentations, it is categorized into the external and the internal pile mass. The internal pile mass is wherein the lesions cannot be felt and is usually seen at the lining of the rectum, and it is less painful and only the symptoms could be just bleeding. Bleeding in the sense bleeding along with the stools, or it forms as a bleeding as a splash after the passage of stools. Whereas the external pile mass is usually very painful, swollen and can be felt. The symptoms usually is pain on defecation and also bleeding. So here there are various factors which contribute to this formation of hemorrhoids or piles. The usual causative factors are hereditary, wherein it runs in the families. And the next important contribution is the constipation, when usually people strain to pass stools. This brings about this pile formation. And the next thing is sitting for a longer period of time. It can be professionals like the IT professionals or the drivers who have to sit for longer duration of time. Then in women, one of the causative factor that we see is during pregnancies. Pregnancy, actually the expansion of the uterus puts a pressure on the rectum. Then there are other symptoms like hypertension, even complaints of wherein patients who are chronic smokers. These chronic smokers, when there is bleeding, it is difficult to arrest the bleeding if they are smokers. These are some of the common reasons for why people have these piles or hemorrhoids. The management through Ayurveda is that there are based on the different stages of the presentations. Usually the piles or hemorrhoids is classified to 4 stages based on the complaints or the severity of the complaints. Usually in the first and the second stage, oral medications will help them. Oral medications to first ease out the bowels, that is clear bowel, remove the constipation. So various medications like Chiruvilladhi, Kashayam, Gandharvadhi Kashayam or Triphalachoornam with warm water gives you real good relief, and this has to be maintained by taking in other lots of fruits and vegetables, maintaining fibre rich diet and taking in lots of green leafy vegetables. Among vegetables, yam, radish, cucumber helps. And also taking in on empty stomach, you can soak raisin overnight and take it. This helps in clearing the stools and also reduces the body heat. But there are other ways of management if the conditions have crossed the second stage and reached the third or the fourth stages. And the best to use Ayurveda in these conditions is that it saves you from surgery, and also it not only treats you from your symptoms but as well as the conditions totally. So that is where Sharasoothra comes into picture. Sharasoothra is nothing but a medicated or a thread which is laced with medicine. This is tied to the pedicle of the pile mass. And then over a period of time, the blood supply to this pile mass is cut off and eventually it falls off in a matter of 10 to 12 days. And there are other treatments like the agnikarma or the cauterizations. But there is a clear-cut indications that all this has to be done and the relapse has to be prevented by following a very healthy lifestyle, which includes diet as well as exercises.